Sister Radio broadcasting from Hillsborough, Carriacou, and of course, 94.9 We Noise Radio out there in Brooklyn, New York. A very special good morning to those of you joining us on the live video, whether it's on Facebook, whether it's on YouTube, whether it's on Instagram. A special good morning to you. It is a beautiful, beautiful, beautiful Monday morning in the Spice Isle of Grenada, wherever you may be, whatever it is that you are doing. I hope that you are having a very productive morning. All right. I hope that your Christmas celebration was productive one, a safe one, and keeping in line with the protocols, following what it is that we are supposed to do as a people to keep each other safe. A lot has happened over the weekend, and of course we are grateful to be alive and kicking this morning. We have so much to be grateful for as we approach the new year. We don't know what this new year is going to bring. We don't know what we are going to encounter in this new year. But of course, we do hope that in everything that we do, we put God first, right? All right. This morning, I am expected to have with me in studio, well, not in studio, but he's going to be calling in Mr. Kevin Frederick, who is the communications officer at the Ministry of Health, and he's going to be giving us a quick update on what is happening re-COVID. We know that we are currently going through a situation of a cluster and trying to manage that cluster, and we've had the curfew put in place. There are people who think that it is unnecessary. There are people who think that it's absolutely necessary. There are people who feel like maybe we should just lock down and done, But however you feel about the situation, whatever your decision or whatever it is that you are doing, what I do want to encourage most of all is that we follow the protocols, that we follow the protocols. It is very, very important that we do this. I've heard some of the weirdest reasons as to why we feel like the protocols are not necessary. But however we feel about it, you have to remember that you are following the protocols not just for yourself, but you are following the protocols for people who need it most. And we're speaking about people like those who are immunocompromised. These are the people that we are doing it for. So it is important that we follow them. So we're going to wait on a call from the Ministry of Health. But as we do that, I want to share with you some information regarding or an update, as you call it, regarding the COVID situation. As of yesterday, the Ministry of Health would have sent out an announcement stating that we have recorded 12 new cases of the coronavirus, 6 of which were imported cases. And we've spoken about this here before. We've made mention of the fact that as long as the borders are open, right? And this is not just here, but this is internationally. As long as your borders are open, you are expected to have imported cases. What is important to note, however, and what I want us to pay attention to, is how these cases present themselves. So, for example, we've had 6 new imported cases. These individuals arrived in Grenada and went straight to quarantine. All right? They went straight to quarantine. That is a managed situation, right? It means that they would have been in quarantine, tested, and received their results in quarantine. These things we can handle, all right? So we are going to have imported cases. It is going to happen. What is important to note is how these cases present themselves. Are we having random cases just popping up all over the place, which is something that we do not want happening? That is something that we have to look at. So what we are grateful for is the fact that the protocols are in place and the protocols are working, right? We as a people just need to do our part. We need to ensure that we are following the protocols that we need to follow to keep us safe, to keep the wider population safe. So 6 imported cases. Those individuals arrived in Grenada last week and they went directly into quarantine, tested positive on the 4th day of testing. The other 6 individuals, however, are individuals who are associated with the cluster. All right, these people are associated with those previously reported in the cluster. All right, each person so far has been either asymptomatic or exhibited mild symptoms, which is a good thing. So we are still on the track where we are at 0 deaths. And of course, we are grateful for that because, even 1 death means that some family will be displaced. Some family will be affected. Some family will be put into grief. So that is something that we do not want. All right, and I'm going to read to you the rest of the release, and it says, as challenging as the last 2 weeks have been, health officials are encouraged that the number of positive cases has not spiraled out of control in a manner that overwhelms the healthcare system. And I want to pay very close attention to that particular piece of information. While it has been a difficult situation, while the past trying, not just for health officials, but also for individuals who are associated with these cases, for individuals who have tested positive, for individuals who have been waiting on their test results, for individuals who even feel like they may have been affected, it has been trying for them. And for that reason, it's been a challenging last 2 weeks, all right? But on top of that, there is a silver lining because, I love to look for positivity in all situations. There is a silver lining, and that silver lining is that it has not spiraled out of control. So while we may have seen a spike, while we may have seen an increase in the amount of cases that we are accustomed to seeing, it has not spiraled out of control. And that is something that we have to be grateful for. Usually when you see people reading these and I've looked at the comments, and I must say that I'm very disappointed because there are some people out there who are just hell-bent on looking for the negativity in everything that is produced and not looking at the silver lining, And the silver lining in this situation is the fact that it has not spiraled out of control in a manner that overwhelms our healthcare system. So that is a plus. It is a positive. Also, the current number of active cases as of yesterday is 46. Some may be saying, well, how come it's 46? I thought we were at 59 or 60 or something like that. It is simply because some of the cases prior have recovered, been retested, and have come back negative, right? Meaning that they have recovered. That has, in addition to what we have just received, brings us to 46 cases. So it does go hand in hand with the fact that we have not spiraled out of control. So we are very grateful for that. Now, understanding the demands of the holiday season with the influx of travelers, as well as the local epidemiological situation, laboratory technicians worked through Christmas. Thank you. And I want to say thank you, especially for the people who have been sitting in quarantine for a while, past the 4 days or the 5 days or the 6 days, that have been sitting there very patiently waiting on their results, understanding that we were dealing with a cluster, understanding that we were dealing with a situation that demands a little bit more focus on our local testing. I want to say thank you to those laboratory technicians who worked throughout the season. Those of you who have families and you may not have been able to spend time with your family members. Those of you who will be able to spend half of the day or who worked additional hours. Thank you. We want to say thank you. You know, we don't say thank you enough, but we do want to say thank you to those people who have taken the time to work overtime to deal with the COVID-19 cluster that we have been dealing with. So we want to say thank you to you. All right. In addition to those, hundreds of other individuals also had to be retested to ascertain the true status or to be medically cleared from their incubation period. All right. So they had to do additional testing apart from the fact that they had to test new people within the cluster, but they also had to test people that were already in the cluster to clear them or to ascertain their actual status. So we want to say thank you for that. It has been and continues to be a challenge, but the laboratory technicians and the team at the health desk continue to work assiduously to prove themselves equal to the task, testing and working to deliver results in a timely manner as possible. All right. The ministry continues to solicit the practice of the public as well as the cooperation as officials work to address every aspect of this current health challenge. Through all the work done over the Christmas holidays and with the compliance and sacrifices of most of the population, there were still reports of several individuals, families, and businesses disregarding the rules for social gatherings, physical distancing, and the wearing of masks in public spaces. Already stretched resources had to be deployed to address those reports of non-compliance, which puts us all at an enhanced risk of contracting COVID-19. Again, the Ministry of Health implores the support of the public as together we battle this deadly disease. No one wants a situation in which today's flouting of the rules results in a spike of cases tomorrow, or worse, any resultant loss of lives stemming from careless and selfish behaviors. The Ministry of Health also appeals to all to work together to contain the virus so that we can all look forward to the day when the traditions of the holiday season and every other season of the year to come will be more celebrated freely. And I feel like this speaks for itself. And I want to speak to very quickly the non-compliance. And it's sad that at a time like this, we still have to be talking about non-compliance. It is ridiculous. I do not understand why, as adults, we cannot be, regardless of how you feel about the government, and we have said this time and time again, regardless of how you feel about the government, this is not an NNP NDC issue. This is not an issue where if I don't listen to what the administration has to say, or I don't support what the administration is saying, or I don't believe in what they are saying, COVID-19 is just going to skip past me and go on to the other person. It does not work like that. COVID-19 is no respecter of age. It's no respecter of political affiliation. It's no respecter of nationality. It's no respecter of social status. COVID-19 has no respect for people. And with that in mind, we must respect COVID-19. Because at the end of the day, we are all Grenadians. When one person gets affected, we are all affected. And that is how we must look at it. We must stop, and it is high time that we stop this blame game, that we stop this nonsense where we feel like COVID is a money-making scheme, which is ridiculous. I do not understand how COVID-19 could be a money-making scheme for this administration. If anybody knows how they're making money off of it, please let me know. Because apparently you have some insight that the rest of us do not have. But I would like to know how it's a money-making scheme. I would like to know why this administration would look at just wanting to shut down the country or want to confine people to a state of curfew. Do we not understand at this point that any limit in the movement or limitations in the movement of people is a struggle for us economically? Do we not yet understand that if we close our borders, not only would the country suffer, but individuals within the country, their economic status would be affected as well? What more would it take for some of us to understand that? For some of us to put politics aside? For some of us to put division aside and work together and see this for what it is? A virus that is no respecter of people, whose main goal is to infect. Why are we not looking at it in that light, in that way? Why do we not see the benefits of us working together as a people to combat COVID-19? And these are the questions that I have for the general public. Because it is difficult to sit at home on Christmas Day and on Boxing Day and on Christmas Eve night and going through social media and seeing scores of people in the streets, scores of people gathering when we were asked not to, understanding the situation. You know, it's like a house on fire and you inside the house, but because you didn't start the fire, you ain't gonna try to get out. You know, it's kind of that situation. Oh, well, we're not responsible for the spread. We're not responsible for the cluster, so we are not going to follow the protocols. And that is a very, very sad way to think. Because it puts us now in a position where your ignorance is affecting the wider population. I am the mother of an immunocompromised child. And it gives me anxiety. It makes me nervous every time that I see people doing things that they're not supposed to be doing and putting me at risk and putting my child potentially at risk. It makes me nervous. And I'm doing everything that I'm supposed to do. I'm wearing my mask. I'm social distancing. I'm obeying the curfew. I'm sanitizing and washing my hands. But guess what? It just takes a few people who feel that they are above the protocols, who feel that they are more than the administration, who feel that what they believe supersedes what COVID can do, to be reckless and endanger my life and endanger the life of some other immunocompromised person. And that's how serious the situation is. So I want to appeal, not just as a radio personality or a host, not just as a Grenadian, but as a parent, as the mother of someone who could be seriously and severely affected by COVID-19. I am appealing to Grenadians all. Please, let us do what we can. Let us follow the protocols in the way that we are supposed to follow the protocols. Wearing our masks, and not just wearing it and putting it under our nose, but wearing it in the way that we are supposed to wear it. Social distancing, limiting social gatherings, going out only if absolutely necessary. Washing your hands. These are the things that are in place to protect us all. It's not just to protect a few. It is not just to protect some. It is to protect us all. We cannot be selfish in a world where COVID-19 exists. We cannot afford to be selfish. So this is my appeal to you as a mother, as a parent, as a Grenadian, to please follow the protocols. I don't know how or who needs to come and sit here to tell us, or to sit on any other platform and beg and plead with us, big consenting adults, to follow the protocols. I don't know what needs to happen. I don't know what we are waiting for. I don't know what we're watching and see. You know, sometimes we say, well, I'm watching and see what will happen. I don't know what we are waiting for before we take this thing seriously. Before we see the protocols as a measure and a means to save our lives and not something to confine us or to keep us in one place or to control us. I don't know what we are waiting on to happen before we understand the severity of the issue at hand. Not just the public health aspect of it, but the economic aspect as well. I don't know what more we have to do as a people to respect COVID-19. I don't know. I mean, I looked on social media over the Christmas holiday and to see people in I mean, it was very disappointing. It was disheartening. Sometimes we focus so much on the negativity. We look so much at what is wrong in Grenada that we do not even care to see what may be right. We don't even care to see or even to listen to just a little bit of positivity. We don't care about that. What we want to focus on is the negativity. We want to focus on what is wrong. And that is a very dangerous game to play. So we're going to take a short break, guys. And when we come back, hopefully by that time, the Ministry of Health will be with us to discuss the current state that we are in as it relates to COVID-19. We'll be back after this short break.
19 spreads from person to person through the droplets that are produced. 19 spreads from person to person through the droplets that are produced when someone coughs or sneezes, which makes it easy to spread between people in close contact. Now let's get prepared to stay healthy.
To reduce your chance of catching or spreading COVID-19, practice these simple everyday preventative measures. Droplets can also land on surfaces, so ensure that you wash your hands frequently for a minimum of 20 seconds or sing the happy birthday song twice. Avoid touching your face, especially your eyes, nose, and mouth. If soap and water are not readily available, use an alcohol-based hand sanitizer with an alcohol content between 60 and 90%. 70% is ideal.
When you cough or sneeze, cover your nose and mouth with a flexed elbow or a tissue. Dispose of the tissue immediately and then wash your hands. If you notice someone has a fever and cough or other symptoms of respiratory illness, avoid close contact when possible. Let's all do our part to ensure that each and every Grenadian remains healthy. Our health is our collective responsibility.
Is asking all residents who have respiratory symptoms, including cough, shortness of breath, difficulty breathing, or fever, to get tested for COVID-19. Protect your family and yourself. Make the call 538-4787 or 458-4787. Get tested. Save your life. Save my life. This has been a message from the Ministry of Health. Every person in Grenada, Carriacou, and Petit Martinique is required under the Emergency Powers COVID-19 Number 4 Regulations, Section 2.4a(b), to wear a mask or suitable covering over their nose and mouth whenever they leave their home, attempt to enter, or is in line to enter a place of business, government offices, and while in a motor vehicle with any other person. Be COVID-19 smart. Obey the law. Cover up. Wear your mask.
All right, guys, and we are back, and I want to believe that we have the Ministry of Health who is online with us now. Hello, good morning.
Good morning.
Hi, good morning.
Good morning. Yes, Ms. Duncan.
Hi, how are you?
I am doing fine.
All right, that's wonderful. So, guys, online with me this morning, I have Mr. Kevin Frederick, who is the communications officer at the Ministry of Health. Is it officer or coordinator? Don't let me misrepresent you, eh?
It make a difference.
All right. Now, I just want us to get a quick insight, Kevin, on how things are going re-COVID. I know our last update came yesterday that mentioned we are now at 46 active cases. And of course, people are questioning, well, how come it's 46 and just last week we were at 60? So I'm hoping that you would give further, insight into that. But first of all, let me say thank you, because I know not often you guys get official thank yous. I know you get a lot of bashing when the time comes for it, but not often do you get thank yous, because I know you guys have been working hard throughout the Christmas season, ensuring that people that need to be tested are tested, to ensure that results that need to go out are given to the relevant people. So, of course, we want to say thank you to you and, of course, your entire team who would have worked throughout the season to ensure that that Grenadian public is kept up to date. All right? But give us a quick update on where we stand right now. Why are we at 46 cases? What is the status of the cluster, and how has testing been going for that?
All right. Well, let me say thank you again, and also on behalf of the Ministry of Health, of course, our Minister and our PS, our CMO, and the entire staff of the Ministry of Health, we would like to say thank you for of course, your kind words and the words of encouragement, most importantly. Where we are now, I would say, from a public health standpoint, we are not in a good place. We are not where we want to be, and that's because we always believe that one case is one too many. So we know that our numbers are declining. However, we wish it was taking place faster. We also wish that we were never at that place, but it is what it is, and as such, we are doing our very best to to ensure that those numbers comes down as quickly as possible. You quite rightly give the overview based on yesterday's news release. So yesterday we had a confirmation of an additional 12 new cases that we recorded. Now, and of that total, um, six were imported. So six of the 12 imported recorded cases, that's confirmed cases, were imported. Now, and as we said yesterday, the individuals in question arrived in Grenada in their last week. So we're looking at the week leading up to Christmas, right? And of course, they were sent straight into quarantine and they were tested on day 4 as per our protocol. Now, the other six, as we also indicated, were locals who are connected to the previously reported clusters. Now, you would recall that we had cluster cases, as we said. For example, Post Royal, we also had clusters in the south of the island. And we know, how it all came about. So there's no need to really go back there. What I could tell you, though, importantly, is that all of those persons are in quarantine and they are asymptomatic, right? As well as some are also exhibiting very mild symptoms related to that of COVID-19. Now, currently, we have a total of 46 cases. Now, that's 46 cases, and you said earlier that some people will be like, well, how come it's now at that and we first reported that? Let me say, though, that what we have been doing over the Christmas holiday was to try and clear a lot of the backlog cases. We also worked at discharging persons who were in quarantine, meaning that ensuring that the test results came back negative, and also as a result of that, making sure that they were medically cleared to reintegrate into society. Hence the reason why we worked on those days to ensure that the numbers that you are seeing now, it's down. So yes, I understand that persons might be concerned or are concerned as to, well, how come it happened like that, and it's because of the amount of work that was put into it on, if you want to say, on the weekend. Now, which was rather tedious, and I must say again that as a team, we pulled our resources together and tried our very best, make that ultimate sacrifice to leave our, families and so on, at home and, go there and do what's necessary. So, for example, between Christmas Eve and yesterday alone, we had tested a total of 201 persons. That's persons in quarantine and contact trace. So that's between Christmas Eve and yesterday, right? Granted, we did not work so much in the field on Boxing Day and so on, but we actually did that. Now, we have a total of 74 recovered cases.
Mm-hmm.
Now, and our numbers since the outbreak started, right, stands at 120.
Okay.
Now, if I look at and I just want to be clear on something, eh? Now, we do something called the EPI report. And the EPI report summarizes everything that happened with respect to all of the notifiable disease,
Right.
of which COVID-19 is one of them. And I think it would be helpful if I say here, because some people may want to add what I'm doing and to see if there is any mix up, and I welcome that.
Okay.
Now, with respect to the imported or input related cases, and I'm taking that from the EP report, and bear in mind that the EP report is a weekly report, right? Now, that weekly report, we try and do it every Wednesday or so. Now, so from the imported or import related cases, we had 101, right? And that's since the outbreak would have started, right? Now, currently, as I said, we have 120. So we are looking at that statistically, that is.
Right.
Now, the number of PCR tests we would have done so far, that is since March, it's over 15,000. Now, I am telling you this. If one was to look at the EP report, remember I said the EP report is completed every Wednesday, right?
Right.
Of each week.
Right.
Because we have to report to CAFA and PAO.
Right.
Now, so when the report was last published, it was 14,932. Now, that did not include what took place later that day, Wednesday.
Right.
And so it didn't take into account what took place Thursday and over the weekend. So that's why I am telling you, because I know that we worked and how many, I'm looking at figures in front of me, I can tell you it's more than 15,000. But like I said, the EPI report will say 14,932. But it will not reflect PCR tests that took place after the completion of the weekly report.
Right.
Right? And it's called weekly because it would feature the previous reporting week. So you may say the report will reflect what took place from the Wednesday of the previous week up to the Wednesday of this week. So, for example, if you was to see the report that will be published on Wednesday coming, it will reflect from Wednesday last to Wednesday of this week. That's how it's done in the EPI cycle.
Right.
I just wanted to be clear on that.
Right.
Very well. Now, I want to share with you some figures likewise. So now, the total amount of travelers we had seen for November arriving in Grenada, that was 2,410. And for December, right, up until Christmas Eve, we had a total of 2,330. And that's arrivals.
That's
and
a lot.
Arrivals in that case means both visitors as well as returning nationals.
Okay.
So I don't want persons out there to go with the information thinking that it's only visitors we had that coming in that making up that number. That would not be the case, and that is not the case at all. It's a mix of persons, returning nationals as well as visitors to our shows. Now, before you, and just over the Christmas holiday alone, that was between Wednesday, the 23rd, and Sunday, we would have conducted a total of approximately 1,300 PCR tests.
Wow.
It speaks to the level of dedication, the level of commitment, and the hard work that had to go into all of this. I could tell you too, we had nurses on the road, just walking out there, and notwithstanding the fact that we understand that we have a responsibility and a duty because, us as public health officials, that's what we really signed up to do, as some people would say.
Yeah.
But I must say too that the level of abuse and insults and disrespect that was meted out to us, you know, we other people need to really do better.
I agree.
It was rather uncalled for, you know, threats and so on, and you know, one can only imagine how traumatized some of our, you know, personnel are, you know, having to leave the family behind on Christmas Day and so on, you know, and go out there, you know, to work, and you know, being abused by persons, and you know, it is for their own benefit. It is just unacceptable.
I agree.
You know, and so we are calling on the persons out there who are engaging in that type of behavior, you know, to, you know, really think twice about it, you know. Because, you know, it does not do you or our healthcare provider any good. You know, and, you know, my heart goes out to all the persons who were in quarantine. You know, we understand, but also my heart also goes out to all of our healthcare providers, you know, who have been providing, you know, human services, you know, to the people of this trial.
Well, Kevin, I do want to echo in the sentiments expressed. I do feel it for you guys, because you know what, at the end of the day, and I say this often, that we have a team of 15 representatives who form the government, or who form the cabinet. However, you do have to take into consideration that the government is so much more than these 15 representatives. It comprises of you guys, the health team, the doctors, the wardens, the nurses, all of the officials, the laboratory technicians, all of you guys have been working very hard to try and get a handle on this thing, to try and ensure that tests are done in a timely manner, to ensure that at the end of the day, the healthcare system is not overwhelmed by an outbreak of COVID-19. And I look at the comments just as you guys have as well. And trust me, if I was a health official at this point, and this is just me, and that's probably why I'm not cut out to be in you guys' shoes, I would have given up, you know, because the lack of the ingratitude is the word I'm looking for. The ingratitude of some people, and I don't know what is causing it. I don't know why people feel that it is okay to verbally abuse other people. I don't know why people feel that it is okay to just lay disrespectful words on other people. I don't know where we've gotten that from, but I really wish it would stop, you know. And I wish they would understand that it's somebody's mother, somebody's brother, somebody's husband, somebody's sister who was out there on Christmas Day working hard to ensure that you were safe. You know?
Yeah, I think you put it into perfect context, you know, because we have been saying time and time again that health is, and I have to say this, I can't understand why some people would think that the individual health and the personal health and well-being, right, as individuals, it is the responsibility of the government or of someone else. This is the most foolish thing one has to really put up with. When you hear grown people say, so for example, I was at a facility recently, and a grown man said, up to now, the government has not told us thanks for staying home as yet. But in the same breath, he said that he received some check, right? So I laughed. I said, so hold on, the government should tell you thanks for keeping yourself safe? I said, well, you know what? Yeah. I said, it's only you know, an idiot that will, you know, I mean, think that way. I said, because listen to me, your health is not the government's responsibility. Your health and well-being is your individual and personal responsibility.
Absolutely.
Okay, so why should government tell you thanks for staying home and keeping yourself safe? I say, well, you know what? If you're waiting on me to tell you thanks, you have a very long wait because it is not going to happen. You know, and on top of that, he was boasting that he got a check. No, I have been working and I have not been getting anything, and you come telling me about you get a money. You know, but government should be telling you thanks for that, please. I mean, these things, it upsets me because I know that we are out there, right? We are doing this. We're not asking for money, you know, but we are there. There are times we get back home late at night, well, mornings rather, because by the time we reach home, it's like after 12 and 1 and 2 in the morning of the next day. And we come back to work very early again the following morning, right? But and you sit there on your laurels and telling me up to now nobody entered the thanks for staying home as yet.
Yeah. And you see, that's one of the biggest problems that we have. People not understanding their own personal responsibility in this fight against COVID-19. It's not just about the government putting protocols in place and you having to follow them, but it's the reason why you are following them. It's understanding the reasoning behind why you're doing what you are doing. It's not just I'm putting on a mask because the protocol says so, or I'm putting on a mask because government says so, but I'm putting on a mask because it's going to save my life. And I think that's how we have to look at it.
You know, that's the exact point. And you know, at one point he said, listen, you know, I'm not even going to dignify that with a response. I said, I agree. You can't, because the more you open your mouth, the more you sound foolish, because no one will ever accept that they should be looking after your well-being when it is your individual responsibility. And it is clear. Right? If you look at plenty literature, it tells you health is a personal response. I don't have to come and tell you brush your teeth or buy toothpaste and things for you. It is your responsibility to do that.
Yeah.
I don't have to be coming, you know, and tell you wash your hands after you touch so many high-touch surfaces and social distance. It is your responsibility. The information is there, and we tell you what is best at this time. So I don't have to come and hold your hands and wash it for you or tell you thanks for washing your hands. It's just ludicrous. I mean, I don't think you know people really take this thing serious. And while we are on taking it serious, Miss Duncan, it is high time that persons adhere to the COVID protocols. Flaunting the regulations does not make you a big man or woman. Yes?
You are right.
It does not make you much more better than me or less than me. Flaunting it does one thing. It puts you and me and your loved ones at risk. That's all it does. Yeah. But it does not make you, a superhero.
Yeah.
So that too, that too is something that we must pay close attention to. Now, I have seen a number of my villagers and so on, behaving in that type of manner. And those who I can talk to, I talk to them, right? Those who I can encourage, to do better, I do likewise. And the ones who I know will just turn a blind eye, I leave them and I let them be, because I am not going to engage in no debate unnecessarily with anybody. And I think we are all able to think and think properly, right? And as adults, we know what's best for us. If children can wear the mask and wear the mask properly and social distance, I don't see why an adult finds it difficult for that to happen. I am very sorry, but I just can't see it happening.
You're right. I want to just as you mentioned children, I want to just stop there for a moment, because something very, I don't want to call it ridiculous, I find I'm using the word ridiculous recently a lot. it was very disheartening. It happened on Christmas Eve.
Mhm.
I saw, I don't know if it was necessary. For those of you who thought that it was absolutely necessary, this is not for you. And I feel like I need to say that because some people take things that do not even apply to them personally. If it does not apply to you, do not take it personally.
I agree.
But there are parents who allowed their children to go into town and lime as if it was a normal Christmas Eve. And I found that very, very irresponsible. And I'll tell you, I mean, you're dealing with a situation where we have COVID. It is not normal time. Let's just start there. Whether we had the cluster or not, it is not a normal situation, right? And while we'd like to encourage some normalcy in the lives of our children, we must, as parents, first understand the significance of protecting their health in conjunction with their happiness. So I saw children in town liming and congregating and enjoying themselves, some of them with no masks, some of them with their masks underneath their chin, and there's no supervision to say, okay, well, look, social distance, look, put on your mask. There was none of that. And that was very, very, very disheartening. It was very frightening for me as a parent, because here we are trying to control a situation where there is a cluster, where we are still uncertain as to how far this cluster stretches. But yet we have parents being irresponsible with the health of their children. And I found that very, very, very scary. You know, I don't know what encouraged it, what influenced it. I don't know what the train of thought was for these parents, but it was absolutely, absolutely irresponsible.
Yeah, I fully agree with that. I mean, because the inevitable risk, right? Now, bear in mind, right? They are kids, yeah. Now, and most kids, as we know, outside of supervision, yes, they will see adults doing things and they will do it too. Yeah. Now, that child or group of children may have had to ride on a bus, right? Chances are they would have removed the mask. We know what's happening on bus, on the public transportation system now as it relates to the social distancing, which is virtually impossible, right? And but we also know that children love touching. Now, they may have went into a store and pick up a toy. Now, yes, they would have sanitized their hands on going in, but they don't know what happened after that. And I've seen persons who walked into stores and did not sanitize their hands. Now, I have with me likewise a photograph of a security officer of a particular fast food outlet who was sanitizing people's hands, speaking to people, but his mask was under his chin. Right? so these are the kind of inevitable risks, as we call them, that exist out there. And bear in mind again that most persons who we are testing now, right, and who are positive, my God, they are asymptomatic. So I have to agree with you, that when you say that it was irresponsible on the part of, of some parents, to have, taken that risk then. And I'll just stop at that, saying that, it's a risk I don't think that was needed to be taken unless they were accompanying that young child into St. George's. I think to send them out on their own, it's like, like asking for trouble.
Yeah, but even parents who were accompanying their children, even then, you saw them walking with the mask under their chin. I would tell you, I had a very frightening experience. My first day out of isolation, back to work, and I had to take the bus.
Yeah.
And with my situation, I am trying my very best to follow the protocols to a T. So I'm sanitizing my hands almost as if it were an obsession, and I'm ensuring that my mask is on, and I'm ensuring that even when I get into a bus, that I try to sit at the front of the bus so that I don't get into the cluster of people in there and so on, because I have to be even more careful than just the average person to not bring COVID home, and I got into the bus, and the front seat wasn't available, so I found the next best available seat. And when I got onto the bus, there were these gentlemen sitting in the back of me and talking loudly. They're boisterous, and none of them were wearing their mask. And I bought a drink on the terminus, and I said, okay, well, when I get onto the bus, I'll take a quick drink and so on. I couldn't even do that because I was so afraid. When I got to work, I swear I was going to have an anxiety attack because of the fear. These people in the bus, they're talking loudly, not wearing their masks. So can you imagine all of the sputum that's going all over the seats and so on? And then on top of that, another individual, a gentleman, came and stood in front of the bus door, bolted himself in front of the bus door, speaking into the bus to the gentleman in the back of me, also not wearing a mask. So can you imagine how I felt? I mean, I got to work and I took the Lysol and I sprayed my entire... I was just so very afraid, and this is the reality that some of us are dealing with. Some of us who have even more sensitive situations than others. This is the reality for us. We have to be 10 times more careful because of the people who just don't care, the people who just don't take these things into consideration, who just feel that they are above the protocols or that there is some underlying reason as to why the protocols are there, so they're just not going to follow it. That's the reality for us. So we have to deal with anxiety and COVID.
And that's the dangerous part of the equation. And why I'm saying this is because now the persons who are guilty of doing that, right? They don't understand what can happen. For example, one of the things I want to put out there is the mere fact that now throughout our testing, right, a young man in his 30s was diagnosed with COVID. Now he later developed pneumonia as a result of COVID, right? However, I can tell you his last test was done on December 24th. Now, just imagine this, he is in his early 30s. And as to how he would have contracted the virus, I do not know. What I do know is that he's positive. And I can just leave you to wonder and imagine how much of a stressful situation it has been for him and his family. Now, the young man is warded at the General Hospital. Thankfully, our nurses and doctors, they have been doing an excellent job in keeping him alive. Yes? He is showing rather encouraging signs of improvement. And we are happy that our nurses and our doctors and our entire medical care team and support team, they were able to really pull off some magic and do what's necessary to keep this young man alive. Chances are, Grenada could have recorded its first COVID-related death.
Yeah.
And I sincerely believe that because our nurses and doctors and our entire team, they are able to skillfully save lives in this trying times, and no one has died thus far. I think it's one of the many reasons why a lot of the people out there are still taking things for granted, because I hear them every time.
Yeah.
If COVID's so bad, how come nothing ain't happened? How come nobody dead? But God forbid that it happens to one of them or their loved one. I hope it doesn't reach that to that. But if that's what has to happen, I hope he or she who is out there ignoring all of their protocols would not have to come on radio or on some program and say, if I had known. Because I'm telling you, the young man who is recovering nicely, and thank God for that, his family, they are grateful. And his family understands the inherent risk right there.
Right.
But like I say, oftentimes we don't speak about those things because it is not really for us to be speaking about those things, right? But we have taken a decision internally to just highlight and give you more details than what we would have put out there. So, for example, instead of just saying, someone, we just let you know that it's a young man, his age, and how he is doing. I'm not going to call which parish or community he is from, but just to let the so-called superheroes out there know that they are no superheroes where that is concerned.
But
it could be you, it could be me, it could be anybody.
Yeah. But you know what's funny about COVID is that, and I was saying the reason why COVID warrants our respect is because it is not going to single out the people who are not following the protocols. It's not going to single out the people who don't believe in COVID-19. This is not like Santa Claus. If you believe in him, he'll come. COVID-19 is not going to do that. It is going to go after everybody. And it is going to affect the people who can or susceptible to sickness the fastest. And that sometimes might be a person who is following all of the protocols and who has been following all of the protocols. And that is the sad thing about it. The people who are doing the most to go against the rules are sometimes the people who are least affected.
Yeah. That is true.
It's the people who are really trying to survive through COVID, to stay alive, to ensure that their loved ones stay alive. These are the people who tend to be most affected by COVID-19. And that is the sad thing about it.
And hence the reason why, we need to pinch ourselves, we need to ask ourselves if it's really a chance worth taking, or because, maybe for a few hours of liming and so on. And while I'm on that too, I had to respond to a comment sometime back with respect to a statement that was allegedly made by the leader of another Caribbean country when, apparently he joked about Grenada having to institute this curfew, right? And I've said, that as someone who has been practicing public health risk communication for many years, over a decade now, 15 plus years, right? And having been trained and certified and is a trainer of trainers, and having worked things like H1N1, cholera, chikungunya, Zika, Guillain-Barré, a number of them. When you look at the science, what it tells you, it is sad that a number of us Grenadians here would have given legs to what the Caribbean leader would have said and joked about it, made a mockery of something that is very serious and not understanding how foolish they are. I'll tell you why. Now, persons are more likely to drop the guards when they relax.
Yeah.
Persons relax more at night.
Yep.
Yeah. We have busy lives during the day. So, and because our security forces and so on are out there, we would not take that chance, okay? And plan protocols as much as we would do at night.
Yeah.
And so it was in his wisdom and acting on the advice of our experts, we decided that we should share that information with the Prime Minister. And so PM, what he did was to announce the curfew, which begins at 8.
Right.
And it is really to discourage social gatherings,
Right.
but encourage social distancing. Yes? Because when that happens, and because we are experiencing cases where most persons are asymptomatic, yeah?
Right.
It is better to break up those gatherings and things that take place at night rather than letting it go, and just people could just do whatever they want. Now,
Right.
I say this to say that, for example, football, night football, very common, very popular, in Grenada especially.
Right.
And I made mention of what we normally see happens close to a bar opposite the bus terminal. During the day when the police officers are out, everybody wearing their mask, everybody social distance.
Yep.
Once the police leaves around 7, especially on a Friday night, see what happens. Roadblock. As I said in my post, party lit. Yeah? And when party lit, what happens? No social distancing, no mask, we hugging, we kissing, we drinking together. But there could be asymptomatic persons amongst us. And that is the risk. Because it's just as how HIV don't have a clear identification mark where somebody can come and say, well, I am HIV positive. So, for example, in some of the countries in the biblical times, you would know that if this person was carrying a particular mark on their forehead, they would have been maybe guilty of something, right? And like you have countries again where I heard of in my readings. So if you see someone with a piece of hand, you know that they were a thief.
Yeah.
It does not happen like that. COVID does not say, well, this is, me. I come like this, I come like that. And that's why the decision was taken to put the curfew from 8
Right.
to 5, so that during that time, people will not take chances and gather. People will more be at home, And it was to, as I said, encourage social distancing and discourage gathering. And so, we ought to see the merit in those things, because us as humans, we behave a particular way. Social science tells us that, how humans behave. And so I don't think, it was a laughing matter. It still isn't one. But I would just leave it there and say that, persons need to actually think for themselves. However, I want to say, though, whereas that Caribbean leader would have joked about that, the COVID situation in his country is worse because they have more cases than us.
Yeah.
So what are you laughing at?
Yeah.
That's what I want persons to understand and ask themselves.
Yes.
Okay, COVID, as he said, COVID is not only attacking people in the night. Then, as much as he knows that, how come he has not been able to put the situation under control? I will leave it like that.
Yeah. Yeah. You're absolutely right. I saw it too, and I saw people sharing it and making memes out of it and thinking it was funny. But what do they say about what is joke for crapo, or what is
Well,
Oh Lord.
well,
and,
you know.
and I look at it and I say to myself, listen, and it also goes back to the point, it's how your people respond, because maybe the people in that particular Caribbean country is being better at following the protocols than we are. So we are sitting and laughing at what the leader is saying, but his people are adhering and we are not. So it also goes back to say it is how each individual country is dealing with or managing the situation.
Exactly. And as a sovereign state, we have a sovereign right to do what we think is best for our country and not what someone else is thinking.
Absolutely. Absolutely. You are correct. So I want us to just quickly, because time is upon us, to just quickly look at where do we go from here. The new year is about to start with the implementation of the curfew. As health officials, have you guys seen it as a plus? Are we looking at, given the actions of some of the people during the season? Because I looked at, I believe it was GBN or MTV, one of those news media outlets went into the streets on Christmas Eve night, only to find that after the curfew hours, people were standing at the terminus waiting for a bus after 8 o'clock. People were walking around St. George's as if it was St. Andrews as well, as if it was nobody's business, as if there was no curfew, as if nobody spoke to them, as if they had nothing to be concerned about, and people were just going about their business. What could that potentially mean for us in the upcoming weeks?
Well, Ms. Duncan, I don't want to sound any alarm bells, but to put that into perspective, I just want to see that we are approaching this very, very seriously, in that we have to now look at what the potential fallout can be in the days and weeks coming. And I'm saying this because it's that same model we normally use around Carnival time. Now, we know what happens around Carnival, right?
Right.
And let me say this. After every festive season, we always see an increase in sexually transmitted disease and infections.
And viral infections as well.
Yeah, right, yeah. And we know it's common, meaning that it's going to raise its head after the festive season. Now, we are hoping that that is not the case with COVID. But we have seen, for example, a large party in Guav, I think it was on Christmas Day. Yeah. I saw it on social media because I live at Guav, but I didn't go nowhere. I was at home. And, I saw it. And I saw people drinking, partying, having a good time. Absolutely no social distancing. I only saw one guy wearing a mask, one guy wearing a black cloth mask. Everybody else was just having a good time. And what is frightening though is that it was not only people from Guelph who were there, people from all over.
Yeah.
Now, God forbid, if one or two persons, let us say, there were persons who had to be in quarantine, right?
Yeah.
Who breached quarantine and went there, and assuming that that person was positive or awaiting the test result, and this morning they found out that, well, you know what, you are positive.
Yep.
But you went in Guelph Christmas Day and you had a good time, you hug and kiss and mingle with everybody you could have gotten a chance to. I leave it to you and to your listeners and, to just imagine what we could be potentially dealing with in the coming days and weeks ahead.
Yeah. Yeah.
That is the inherent risk that we speak about. Yeah. And I mean, I'll say, sadly, it has happened. And again, it's because people are not taking this thing seriously, and people think that you know what? Don't worry, man, because if I get sick, government will take care of me. No one is thinking that if I get sick, I can die.
Yeah.
You know, because they think that there is a magic bullet or some magic pill or vaccine that they just give them, and boom, I'm going to recover.
Yeah.
But I mean, we are seriously hoping that there's not another spike or explosion in cases.
Yeah.
And we are calling on individuals out there, to kindly adhere to the protocols. They are designed not to enslave you but save you.
Yes.
Yeah.
Yes. I like that. Maybe you guys should make it into a post or something, that the protocols are designed to save you,
To save, not
to enslave. Because people need to look at it from that standpoint, to look at it from that point of view, right? That the protocols are meant to protect us, to protect lives, and that if we are unable or if we fail in adhering to the protocols, not only would lives be affected, but livelihoods as well. People who work in the tourism industry, people who work or who are solely dependent on economic activity to survive, they will be affected. Because can you imagine if we were to go into another 3-month lockdown, what would happen to some persons?
Yeah. Quite frankly, I know what can happen. You know? And some of us will definitely be out of a job, and that may be permanently. Because a number of companies, what I have seen is that after they adapt, they don't rehire.
Yes.
So and also I want to encourage the politicians out there, opposition ones and the independent ones. Instead of you finding faults with no one is saying that you should not, objectively, scrutinize and make proper representation, or make proper suggestions to Ministry of Health, government, or COVID committee to rethink some of its strategies. And so we are not saying that. However, we are saying, do not make a bad situation worse then.
Yeah.
By
Absolutely.
throwing fuel in fire. Right?
Absolutely.
Now, encouraging persons to break protocol, encouraging persons to disbelieve what is happening, is not making you look good.
Yeah.
And it's not making our country look good. And it is only making the work of our healthcare team more difficult.
Yeah. But also silence, Kevil. I want us to touch on silence, because sometimes we look at the situation and we say, oh, well, this person, they're not saying to follow the protocols, but they're also not saying not to follow the protocols. The silence sometimes speak louder.
Well, yes.
And it's a good opportunity to appeal to leaders in society, leaders in the community who find it more profitable to make noise about more negativity than to appeal to the Grenadian people to follow the protocols, because this is what we are dealing with now. This is the reality of our lives. This determines the future of Grenada.
I mean, absolutely, and even so too, the caretakers of various constituencies, where that is happening, right? I need to hear them coming out and denounce those kind of a social gathering. I'm saying that because, again, I will make reference to where I live in Guelph. Right? I would be happy to hear, whoever the caretaker is, and if there are more than one, parties with interest up there, whoever they are, denounce what happened. Again, let us remember, you had a mix of persons up there, right? They came from all over the place. But people walk different places too, eh?
Yeah.
So some of us now came down in town this morning, and we taking a bus and going Grenada, or going St. Paul's, or going Boca, right? Or going up, north. And if we are what we call just recently, at one of our trainings, we came up with that idiom theory, So I was like, just as how you have a sleeper cell, right? In terrorism language,
right?
Yeah, an asymptomatic person, is a sleeper spreader.
Yeah,
meaning that they could spread it. Yeah. So no one knows because they are a sleeper spreader.
Yeah.
And you have sleeper cells in terrorism. So you just draw the whole nexus there and see what's happening.
Yeah.
So persons need to really think about that, because I'm going to say this: don't expect a vaccine come next week.
Yeah.
It's not going to happen. It's just not practical. Yeah. And yes, we have signed on, as the Minister said. And I can tell you that our team, met. I participated in the RHCN training. And this too is another uphill battle that we are going to face moving forward because of all of the myths and so on out there. But persons need to understand that the protocols, as I said, was designed to keep you safe. It was designed to save you and not enslave you.
Yes.
Yes. And you have a responsibility to preserve your health.
Yeah.
And so washing hands is very simple. Using a hand sanitizer is very simple.
Yeah.
Wearing your mask properly, and discarding of your mask properly and safely.
Yes.
And maintaining the physical distance is very, very, very crucial to our success and moving forward. As I said at the top of the program, we are not in a better place, quite frankly. Yeah. We prefer to go back to the low numbers that we had enjoyed. And persons may not know that, Ms. Duncan, but do you know for like about 3 or 4 months steadily, we have had no reported cases of COVID?
Yes. Well, for the people who are following, they know. But for those who just wait for a release to come out, they wouldn't.
Exactly.
They wouldn't have known.
Because I was counting those months, and we were doing fine.
Right.
Right. But we always knew that there was a possibility that we could have seen another case or cases again, because like I had said, and I think I did it right, when I looked at all of my data and so on, I knew that our second wave would have started around the middle of November into December, and I was correct. And my PS, Dr. Martin, said so. He said that I was correct.
Right.
So, we can only advise persons out there to do the right thing. Absolutely.
Now looking at the numbers, we've had 2,330 people coming into Grenada for this December season. In all of the people that have come in, all being tested, I must say that we've done well in terms of the amount of important cases that we've brought in. But can you just put a number to that amount for December, just for this season? Because we know that the amount that came in, but how many cases have we imported for just this December season?
And that's what I was trying and get from my CMO before I joined the program. But of course, we were busy doing other things, still clearing people, and he had to go through his database. If you would allow me, I could actually get the number. What I might be able to do for you, right? Because I have other members of my team working on that. I was attempting to give you the amount of arrivals we had from the Caribbean region, US, Canada, and UK/Europe, as well as the amount of positives we would have had coming out of those persons who traveled into Grenada. Yes, based on that ballpark figure there.
Right.
Because, they would have been tested after 4 days.
Right.
Now, and as well, it is well established as well, that persons do come in with a negative PCR.
Right.
So it's only after 4 days if we do our in-country PCR testing of you, swabbing and testing of you, and that's how we can then produce whether it is negative or positive. So I attempted to also get that information for you, but the ladies at the desk, they could not have provided for me because, of course, it was a short notice. But they are working on it, and hopefully I can join you. If not tomorrow morning, maybe most definitely on Thursday morning, to give you that picture and also give you another update, because by then, I am certain that by then, because we are expecting more results today.
Right.
Yeah, I am certain that things can change one way or another.
Absolutely.
So let's leave your viewers and listeners wanting, so they have something to come back for. If not tomorrow, praise the Lord, on Thursday, God willing.
Absolutely. So I just want to give a quick...
on Wednesday, God willing.
On Wednesday. I just want to give a quick recap before I let you go. So far, we are at 120 cases overall from since we started in March to now,
right?
Which is a tremendous achievement for us. 101, as you stated, out of those cases would have been import-related, either imported or related to some importation outbreak.
That's correct.
We've done so far 15,000 PCR tests, or around that figure. More tests pending as well. And so far for the season, between November and December, we have had 4,000, let me see if my math's good, 4,730 people coming into Grenada, both tourists and returning nationals.
That's correct.
Well, I must say again, thank you to you yourself, and your team, and the team at the Ministry of Health, all of our health wardens who are out there working to assiduously to ascertain our true status as it relates to COVID-19. And of course, we, on behalf of us here at the New National Party, our HARDTALK family, we just want to say thank you, because you are not just doing the job that you signed up for, but you are going above and beyond that to ensure that the Grenadian public is kept safe. So we just want to say thank you once again. And of course, you know that you are always welcome to call and give us any updates that may become available at any time, so that we can share that with our listeners and the Grenadian public at large.
Well, thank you very much for having me. And we want to wish everyone at your outfit, as well as all of your listeners and viewers, a happy holidays again, and best wishes for 2021. We're going to ask them again, please stay safe. Encourage others to stay safe likewise, and we need to join this fight in order to break the cycle. That's
Absolutely.
the only how we can really do this. We need to join the fight in order to break the cycle. And I believe that if we do that, and when, we do succeed in breaking the transmission cycle, we are going to be in a better place. But as I said, I don't think as public health, persons, we are comfortable where we are now. We are not.
Of course.
So join us in breaking the transmission cycle.
Absolutely. Well, thank you so much, Kevin, for your time, and you have an enjoyable season. And if we don't speak again, have a wonderful New Year.
Thank you, and same to you.
All right. Thank you so much for your time.
Okay.
All right, guys, and there we had it, an update from the communications officer at the Ministry of Health, who is Mr. Kevin Frederick, giving us an update as to what our status is as it relates to COVID-19. As of yesterday, we've had 12 new cases, 6 imported cases, and of course, 6 that were related to the cluster that was identified some weeks ago. And as he indicated, for those of you who missed it, as of March this year, we're still in the year, March this year to now, we've only had 120 cases. Currently, we have 46 active COVID-19 cases, and this is simply because those before would have been medically cleared and given the green light. And of course, we have to add that 12 that just came into that number. So we are now at 46. The numbers are going down, but as Kevin rightfully said, we're not in a good place. We're never going to be in a good place until COVID is completely gone, until we can think of COVID as an afterthought, until we can say safely that it's just COVID. I don't know if that time is ever going to come anytime soon. But what we know we can do is that we can follow the protocols, do what is being asked of us. For some of us, it's a big ask. But when you look at and you weigh the pros and cons, when you weigh the benefits of just following the protocols, they definitely outweigh whatever conspiracy theories that you think you may have, whatever afterthoughts, whatever negative things that may come to your mind. Just think about the people who are fighting for their lives without even being sick. Because that's what's happening now. COVID is causing people to fight for their lives. Every day that you put on your mask and you sanitize and you wash your hands, you social distance, follow all of the protocols, you are joining in that fight. It is a fight. It is a fight to save lives. So every day we're fighting for our lives. Let's play the part that we were meant to play. Let's look beyond how we feel politically. Let's look beyond the conspiracy theories. Let's look beyond this little selfishness that may creep up every now and again. But why I had to do this, I ain't know COVID. The little selfishness. Let us look beyond all of that. And let's look at the bigger picture. That at the end of the day, we would have won this battle against COVID-19 without having to lose a life, without having families caught up in grief because somebody in their household didn't make it. Let us not add to the anxieties of those who are already immunocompromised or their family members who's fighting to ensure that their loved ones don't contract the virus, because there's a very strong possibility they may not make it. Let's think about the realities of what we are dealing with and put aside how we feel about our Prime Minister, about our Minister of Health, about the nurses, about the doctors, or whomever that you feel aggrieved with because of something that was done in the past. Let's put all of that emotion aside and put all of our energies and our efforts into joining this fight against COVID. I just want us to think about that for just a moment. Every time I have to sit here and talk about COVID and talk about following the protocols, I get a little emotional. Because I think about my own situation and how I feel. And then I think about all of the other families who are in similar situations and how they feel. And that makes me emotional. And that alone makes me want to put on my mask every day, social distance if I have to, and sanitize and wash my hands. We're not being asked to give up our whole lives. We're not being asked to bend at the waist. We're not being asked to genuflect to the government. All that we are being asked to do is wash our hands, social distance, and wear our masks. It's all we're being asked to do. For some of you, it seems like just that. But for some people, that simple ask means that they see tomorrow or that they have a future. It means that their life is safe or safer. So let's take that into consideration. For those of you who have been following the protocols, please continue to do so. Please continue to do so. Don't look at those who are not following the protocols and let that dampen your spirit and say, well, if they're not doing it, I'm not doing it too. Why I had to suffer and some people just doing what they want to do? You would be better for it tomorrow. That is all that matters. That you do what you need to do. As they say, brighten the corner where you are. And eventually, everyone would see a little light. Guys, we've come to the end of our program today. It's always a pleasure being here with you. In whatever you say and whatever you do, be safe, be secure, follow the protocols, and have a wonderful, wonderful day. It's been a pleasure. Please stay tuned for the national report. We're doing a replay of the national report from the 24th of, I believe it's the 24th of December. For those of you who are listening, remember there have been updates since then, but of course, we always get a little replay at the end. So guys, in whatever you say and whatever you do, be safe, be secure. I always want to be talking to and with you. I don't ever want to be talking about you. Please enjoy the remainder of your day.
You have to come back in again.
Enjoy the remainder of your day. Have a wonderful day, guys.
I didn't know from my father's brothers.
More than 600 COVID-19 tests to be conducted by the weekend. We'll have details to this story and more in the national report. With the details to the news for Thursday, December 24th, 2020, I am Rikisha St. Louis. The Ministry of Health says more than 600 tests will be conducted by weekend as Grenada continues to build forces to tackle COVID-19. The ministry has bolstered its field teams to conduct testing for COVID-19, but given the massive number of persons to be tested and the highly infectious nature of the disease, extreme care must be taken in dealing with each person. There are currently 59 active cases of COVID-19 in Grenada. The Ministry of Health solicits the patience of all persons awaiting results, including those who traveled to Grenada in recent days and are in quarantine. In the meantime, health officials are advising people to be vigilant and to continue to observe all protocols as they work towards bringing the situation under control. Permanent Secretary in the Ministry of Health, Dr. Francis Martin, says the isolation ward at the General Hospital is fully equipped to efficiently care for COVID-19 patients. He said the expectation is that only 20% of persons who contract the virus will need to be hospitalized. However, a contingency plan is in place to deal with mass hospitalization. Dr. Martin's comment follows concerns that the isolation unit at the General Hospital only has 10 beds and the number of active cases are 5 times the amount. He gave the assurance that the ministry has plans in place to effectively care for multiple COVID-19 patients.
The epidemiology of COVID has remained the same in the sense that we expect that 80% of the people who get infected would have asymptomatic situations, and only about 20% would be sick enough to require hospitalization. That being said, the number of beds that we have at the hospital, although they may look small, but we do expect just 20% of them to be able to hospitalize. So we do have the capacity to deal with that in the event, but also to ensure that if perchance, God forbid, we become overrun by the number of persons that are sick enough to require hospitalization, we also have considered and have discussed contingency plans for dealing with mass hospitalization should that be. And that has been consistent since the beginning of our COVID response.
Continuing the news, with a food import bill of 350 million EC dollars in 2019, one of the major lessons we need to take away from the COVID-19 pandemic is the importance of becoming more reliant on locally produced food. Minister for Foreign Affairs, International Business and CARICOM Affairs, Honorable Oliver Joseph, says we need to import less food and produce more of what we consume.
The lesson is that we must concentrate on food security, ensuring that we could feed ourselves. And I think that has come out in COVID, where you see a lot of people went back to the land and started producing for sale on the local market. So as we move forward, I know there was a committee on food security, and they came up with a plan going forward on how to deal with the issue of importation, the high food input bill, including the high poultry bill of $35 million. And we have now 2 plans that in 2021 will be up and running, and therefore we should see a reduction in importation of poultry products, because it's the most widely consumed meat in Grenada. So the thing is that let us see how much we could produce locally, and let us all as citizens support the local production to do 2 things: to cut back on the importation, which will save us foreign exchange, and also to feed ourselves.
Minister Joseph says the reality is that we will always have to import food because of our small size, and so do not possess the resources to be self-sufficient. But he believes more support can be given to the local industry. This is the National Report. The news will continue after the break.
Are you gonna wear your mask today? You see everywhere you go, there are rules you got to follow, so don't you say COVID-19 will delay. Take the opportunity to save your community. Don't be that guy, put a mask on your face if you're heading outside. It's your life, my life, more lives we'll be taking if we don't try. If you feel any symptoms, call the hotline. Stay inside until you feel fine. 6 feet away every day. Keep COVID-19 far from away. Keep Grenada safe. Be COVID-19 smart.
Welcome back. Minister for Climate Resilience, Senator Simon Steele, admits that his ministry has seen its share of setbacks this year because of the crippling effects of the COVID-19 pandemic. 2020 was supposed to be a big year for the ministry with a number of key initiatives set for rollout. One of the major initiatives gravely affected was the Climate Smart City project. A meeting was carded to be held in Grenada with potential donors and professionals in the field on climate change to discuss financing for a project of that magnitude. However, the pandemic made this impossible.
We were working with the IMF on a donor conference which was going to be hosted in Grenada, which was going to bring international development partners, financing agencies and institutions to Grenada to look at how the financing for a project, a program of this scale, which runs into the hundreds of millions of US dollars, how those resources would be raised. So those activities have been postponed to 2021.
Senator Steele believes 2021 will have its challenges, but with all partners working together, much can be achieved.
I think what we're going to find is a call beyond our basic responsibilities, but a general call to work even closer together, holistically as government, as a nation, in order to achieve the things that we need to do in the year ahead to re-stimulate our economy, get the recovery moving, to create jobs for our people, and to do all that we can to remain safe in this very, very difficult time.
Finally, in the news, government establishes a COVID-19 recovery and transformation subcommittee to evaluate and find solutions to sectoral issues in agriculture, fisheries, agro-processing, tourism, and finance related to COVID-19. The virus has tremendously affected Grenada's economy. Many jobs were lost, businesses were forced to close, and since then, the mantra has been, it is not going to be business as usual. The agriculture sector is one that has been hard hit by the global pandemic, causing delays in exports and imports and in the implementation of key projects. Former Agriculture Minister Honorable Yolande Hosford had first-hand experiences of some of the challenges faced by the sector during the difficult time. She looks back to the period March to October 2020.
It was very sad for the farmers because a lot of the farmers couldn't go to their lands. We had to make sure that food has been secured during that period. And so we had to look at a lot of passes to get farmers to their lands. We had to make sure that they get the gas to gas their machinery, the irrigation systems. So there was a number of problems that the sector encountered during that period. The poultry sector was heavily devastated as well in terms of not being able to get feed in time.
She highlights some of the measures implemented and effects they had on the sector.
A mitigation and response plan was set up to look at the short-term and long-term programs for the Ministry of Agriculture and Fisheries. That plan really dealt with the short-term, long-term, medium-term, and long-term activities for the ministry. So we moved quickly into setting up farmers' markets because we realized that they would have to have alternatives to sell their produce. And so these markets were set up throughout Grenada. Some of the areas that we set up the markets were not functioning well. People weren't able to get transportation to get to some of these areas. And so we decided also to set up little tables. People were able to come out to in their communities and set up a table in front of their homes or near to their lands to sell their produce that came directly from their lands.
Moving forward, Agriculture Minister Honorable Peter David says 2021 will be the year of organization and production. His ministry has received over $40 million in the 2021 budget for programs and projects in the new year. That story just brought the curtains down on the National Report for Thursday, December 24th. Let's recap the top story. More than 600 COVID-19 tests to be conducted by the weekend. On behalf of the management and staff of the Government Information Service, I am Rikisha St. Louis saying thank you for joining us. Merry Christmas. Until next time.